Before you choose a lens for cataract surgery, consider this. The lens implant that you choose is permanent and will define how well you see for the rest of your life. Some can make you see better than you did even before you developed cataracts. The options in 2025 are unlike anything we've seen before. Which lens will you choose? But here's the catch. While choosing the right lens is vital, it's not the only factor for the success of your cataract surgery. In fact, there are other elements that might be even more important than the lens itself. Stay with me until the very end after I review the latest lens options. As a bonus, I'll reveal some factors other than the lens that are crucial to your best surgical outcome. Now, could there really be a lens that lets you see both near and far without any possibility of glare and halos? The first lens I'm going to introduce is the newest option specifically designed to achieve just that. PureC is the newest addition to our cataract lenses. It has a unique design without concentric rings and offers excellent vision at distance and intermediate, and a night vision that is free of glare and halos to a degree that is similar to a monofocal lens. Here on the left, we see a simulated view with a multifocal lens using concentric rings. In the middle, the view is with PureC, and on the right, how it would look with a monofocal lens. In clinical studies, 97% of people were happy with their vision, and an amazing 100% didn't need glasses to see far away. This is even better than what we usually get with monofocal lenses for distance vision. However, the biggest downside to this lens is that it does not provide perfect close-up vision. Other multifocal lenses might help you see better up close, but they often come with a higher chance of glare and halos, meaning you might see rings or bright spots around lights. If you like the idea of seeing things at arm's length, like using a computer without glasses, then this lens might be a good fit for you. It also allows you to see far away without glasses and also some close range reading. If you're okay with wearing light reading glasses occasionally for long periods of reading or for very small print, then this lens might be for you. Well, what if you're the type that doesn't want to bother with glasses at all? Is there a lens that can allow you to see perfectly at different viewing ranges without those horrible halos or glare? The Envista Envy is the newest trifocal lens. Clinical studies show a low incidence of glare and halos and the highest satisfaction rates among multifocals. It has the widest range of astigmatic treatment. This means it can treat very high level of astigmatism, but more importantly, lower levels of astigmatism, which is very important. Why? You see, if your astigmatism is generally lower than 1 diopter, it could remain untreated because most other lenses cannot correct it. So this astigmatism will remain after the surgery and will degrade your vision. Now, if you consider that 74% of the population have these lower levels of astigmatism and they strived for the best possible vision, you know why it's so important to correct it. And how about glare? Only 2% reported severe glare, starbursts, or halos with this lens. To put this in perspective, this is 83% lower than in the Panoptics clinical study. Next is the game changer, the newest addition that made waves in the world of cataract surgery in 2024, and that's the Clearview 3 lens. This innovative lens offers excellent outcomes for both near and far vision as a seamless visual experience. And that's the Clearview lens. This innovative lens offers excellent outcomes. Thanks to its design of 2 lenses in one, the Clearview 3 has a low incidence of glare and halos. This means brighter nights and clearer sights without the unwanted visual disturbances. However, there are a few considerations about this lens that you need to keep in mind. The Clearview 3 is available in a limited power range, which might not cater to everyone's prescription needs. Additionally, it doesn't currently offer an option for astigmatic correction, so patients with significant amounts of astigmatism might need to explore other alternatives. Another important factor is its sensitivity to positioning during surgery. Precise placement is crucial for this lens to perform optimally, which underscores the importance of choosing a surgeon that is experienced with premium lenses. Despite these limitations, the Clearview 3 remains a compelling option for those seeking the latest in lens technology with the potential for outstanding visual results. Now, if you're an outgoing person and willing to accept a slight possibility of glare for the benefit of freedom from glasses for good, the next lens might be the best match for you. It is one of the latest multifocal options on the market with excellent near distance and intermediate vision and also low incidence of glare and halos. Some rings around light could be seen but usually go away within a few weeks in most patients. Meet the Odyssey, one of the latest multifocal options on the market. It provides excellent vision for near and far with a low incidence of glare and halos. While some patients may initially notice rings around lights, these usually fades within few weeks, and there is a lot of excitement about this lens, and some surgeons even believe they can exchange it with other multifocal lenses when there are problems with those lenses. The downside, like with any new lens, the track record is not as long as some of these other multifocals like the PanOptix. I will post a video in a few weeks interviewing patients in which I placed PanOptix in one eye and the Odyssey in the other. If you subscribe to the channel, you can get notified when this video comes out. Now, what if you're a pilot or a truck driver and your life and possibly the lives of many others depend on your vision? Which lens would you choose? So for the last 4 years, I've been using the VVT lens exactly for that purpose. VVT is an extended depth of focus lens without any concentric rings and has the lowest level of glare and halos. In my experience, it offers the sharpest distance vision and excellent intermediate. The very near vision is not as good as trifocals, and you may need some extra help for prolonged reading or small print, but the overall quality of the vision is excellent. It is also a decent option if you have macular degeneration, glaucoma, or some other retinal issues. But what if you favor technology with the longest track record over the newest option? For the past 5 years, I've used the PanOptix lens in many thousands of patients with excellent outcomes. It provides excellent distance, intermediate, and near vision with a very low incidence of patients complaining of glare and halos. It certainly has the longest track record with the largest number of lenses implanted throughout the US. To put that into perspective, you need to understand that most lenses don't reveal the problematic side until I do at least 100 of them. Since the problems are rare, it takes a large number of cases to judge which one is better overall. Now, I do hear stories from other surgeons that they changed the PanOptix for another lens and the patient's problem was resolved. But unless you do 10 of these and you get consistent results, it doesn't mean much because it can also happen in the other direction. Now, I can't finish this talk without talking about one of the hottest lenses, and although it is not new, it has been gaining a lot of popularity recently. This is no other than the light adjustable lens, a lens that generates a lot of buzz but delivers very little impact. Why do I say that? The light adjustable lens is essentially a monofocal lens designed to address a problem that may not be as significant as it once was. The idea behind it is that measuring the exact lens power needed for optimal vision after cataract surgery can involve some degree of inaccuracy. To tackle this, the light adjustable lens offers post-operative lens adjustment to the power of the lens using ultraviolet light during a series of office visits. However, with today's advanced laser biometers like the IOL Master 7 and the LensStar, we achieve extremely accurate measurements that typically eliminate the need for post-operative adjustments. This makes the large adjustable lens a more complex and expensive solution for a problem that modern technology has largely solved. And all this for a lens that isn't even a multifocal. So why has it gained such popularity? In my view, it's the result of a highly effective marketing campaign rather than a substantial clinical advantage. That brings me to the bonus that I promised you. What factors can significantly enhance the chances that you will be happy with multifocal or extended depth of focus lenses? The first factor may seem obvious, but it's worth emphasizing. To get the best results, pay attention to the following statistics. In the United States, premium lens implants are used in only about 10% of cataract surgeries, although this trend is growing every year as awareness grows. The reason for that is, of course, mostly economic. Now, what this means is that most doctors use them in just 1 out of every 10 procedures. Handling premium lenses requires specialized skills and equipment many cataract surgeons may not have. On the other hand, a busy premium lens surgeon might perform 50 to 90% of their surgeries using these advanced options, and many perform more than 1,000 cases a year. My advice? Seek out a surgeon who regularly uses premium lenses to ensure you receive the highest level of expertise and care. The second crucial factor to pay attention to is preoperative measurements. These measurements determine which lens power will be implanted in your eyes, so their importance cannot be overstated. Make sure your eyes are measured with a modern laser biometer like the IOL Master 7, LensStar, or Argos. These devices provide highly accurate measurements necessary for selecting the proper lenses. What I do to enhance the accuracy further, I incorporate an immersion ultrasound measurement as an additional checkpoint. If there's any disagreement between the results of the laser and the ultrasound, I use a second laser biometer to verify these measurements. Although this is not standard practice, I believe in the carpenter's saying, measure twice, cut once. And in the case of eye surgery, 3 times might even be better. I'm planning to make a more comprehensive video about the factors that influence your suitability for multifocal and extended depth of focus lenses. Please subscribe so you won't miss my upcoming videos on this subject. Thank you.